Hi guys, welcome back to the channel. Today we're going to be talking about something rather interesting, which is Desirial Plus, a hyaluronic acid specifically formulated for use in the vulva. But first, you're probably wondering, why am I dressed in such finery like I'm just about to go out on the Raz? Well, it's because I have a rather special guest joining me who is also going to be another permanent fixture on the team. It's a new doctor. Please welcome Dr. Semira Kwabi. Hello.
Oh, thanks, Sarah.
So Semira also does pretty much the whole gamut of aesthetic medicine by focusing quite a lot on doing lasers, intimate rejuvenation and minor surgery. And that's why I have brought her into the video today. We know each other from our hospital days, which we would rather forget. So despite the fact that we are dressed for a night out, we are in fact going to be talking about a hyaluronic acid dermal filler, which is from a company called Vivacity, who also make the other filler brand Stillage. This particular one, Desirial and Desirial Plus, are for use in the vulva and vaginal region. So this is going to be a two-part video. Today we're going to be talking about Desirial Plus. Next week is Desirial. So Desirial Plus, take it away.
Desirial Plus is a hyaluronic acid-based filler that contains 21 milligrams per ml of hyaluronic acid. It comes in a 2 ml syringe, and we use this with a cannula and place it in the labia majora. What it does is it promotes hydration and plumping of the area. It contains antioxidants and mannitol in order to increase the longevity of the product and to also decrease post-treatment swelling.
So who's this treatment for? I've actually had it done.
This treatment is suitable for women who are perimenopausal, menopausal, or those like yourself who are of reproductive age but find that they have atrophy of the labia majora.
How dare you? So it sounds kind of scary. How is it done?
First, I'll numb the skin up, and that takes about a minute or so. And then I'll make an insertion point for a cannula, one that we would usually use in the face for dermal fillers. Using the cannula, we'll go along the length of the labia majora to numb the whole area so that the procedure is painless. And then using that same insertion point, we will use the Desirial Plus to introduce the filler into the area.
So it's quite a large area that we're treating. I imagine you have to use a lot of product.
We do. So we use between 4 to 10 mils per treatment session.
So that sounds like a lot of product. How long would you expect that to last for?
To be honest, the more products we put in, the longer it lasts, but it can last from anything from 6 months to 2 years.
But that's the point of having the mannitol in there as well, is to help to increase the longevity of the products.
Oh, exactly.
That is pretty much like any other dermal filler procedure, actually, isn't it? Because you can have variable amounts of longevity depending on the product and where it's placed.
Yep, and also the rate at which you top it up.
True.
Yeah.
Any tips for after the procedure's done?
Aftercare is paramount, and it's for this reason that patients having this treatment should refrain from sex for 2 weeks, as well as exercises such as swimming or jogging, anything involving rubbing the thighs together. In fact, I would stay out of the pool for those 2 weeks.
Any side effects from this procedure?
Well, like any procedure, you can get some swelling, a little bit of redness, and maybe a tiny bit of bruising at our insertion point sites.
But just to be clear, this treatment is not just for women who are menopausal or perimenopausal. Younger women can have this as well, because it can be something that just, kind of makes the area look a bit nicer. It's not just for function, it can be for form too. I like to use the analogy ham sandwich to beef burger. And I know it's all very trendy now to love your body, to love your vulva, to love your vagina. But if you do want to have that kind of shape and you want to enhance it further, then I don't see any reason why you shouldn't be able to do it. Okay guys, so that's it for this week. I hope you enjoyed the first video with Semira and you enjoyed the topic. Come back next week where we're going to be talking about Desirial, which is very similar, but it's for inside the vagina instead. Let me know in the comments section below if this is a topic you're particularly interested in, and we will see you again next week. Bye bye for now.